my name is Rich. It's nice to meet you. Doctor has asked that I x-ray your foot. Is that right? Which foot, left or right?
Left.
Okay. What happened to you?
I was at karate doing technique and I kicked the bag in the wrong place.
Oh, you kicked the bag in the wrong. Okay. Where does your foot hurt?
In the middle.
In the middle of your foot? You having trouble walking on it?
Yeah.
Okay. Well, we're going to take 3 x-ray pictures of your foot. And that should show the bones, and if there's anything seriously wrong, the doctor will be able to fix it over an emergency room. Okay? Natalie, what's your full name?
Natalie Green.
Natalie Green. Okay, and your birthday?
July 4th, 1990.
July 4th, 1990. Do you have an armband that the emergency room gave you? Can I see it, please? Yep, Natalie Green, July 4th, 1990. All right, we're going to take 3 pictures, and we'll get this done pretty quickly, okay? Okay. Okay, Natalie, we're going to take those 3 x-ray pictures now, all right? Is there any chance you're pregnant?
No.
That's the right answer. Thank you very much. Can you get up on the x-ray table, please? Let me help you. There you go. I'm going to have you go ahead and lie down on the table if you would, please. I asked Natalie if she was pregnant because we would like to keep x-rays away from the unborn fetus. That's an important part of radiation protection. I'm also going to cover her abdomen and pelvis with this lead shield, which will keep any scatter radiation or stray radiation from exposing her needlessly. We're only really interested in her foot. All right, Natalie, your left foot, right? I'm going to take your shoe off, okay? Can you bend your knee? Good. And I'm going to put your foot right on this x-ray plate, okay? You all right with that?
Yeah.
This is the x-ray tube. This is where the radiation comes from and exposes this imaging plate. To x-ray a foot, I need 3 projections. This first one is AP, anterior, posterior. Anterior part of her foot through to the posterior portion of her foot. The central ray enters at the base of the 3rd metatarsal. You'll learn all of this anatomy in Anatomy and Physiology, which is a prerequisite for x-ray school. You'll be using it in x-ray school. Okay? I have now the foot properly positioned on the image receptor. I've got a left marker, and I've got her foot exactly where I need it, and some lead shielding on her. Hold still, Natalie. All right, Natalie, that one came out really well. So we're going to take the other 2 now, all right? I want you to bend your knee again. Good. Put your foot right there. Now I want to roll your whole foot in, 45 degrees, just like that. Good. This is a medial oblique lateral. We need to take different projections of the bones so the doctor can see all aspects of the bones. This is a foot. And a foot has lots of joints. So one of the guiding principles in radiology is if the structure has lots of joints, we take 3 projections. If it's a long bone, like the tib fib or the femur, we only need 2. Hold steady, Natalie. Good. We'll take 1 more projection now, okay? We have this x-ray. Okay, one last picture. I'm going to have you roll all the way up on your side toward me. That's good. And bend your knee a little. Excellent. Okay. This projection is what we call the lateral projection. Or more specifically, this is a lateral, medial side to lateral, a medial lateral projection. Again, The X-ray tube is centered to the anatomy, and my central ray is directed at the base of the third metatarsal. Let me change this around a little bit. There, I think I can fit your foot in there better now. I'm taking a look to be sure that I have her toes and the tuberosity of the calcaneus, the plantar surface, the dorsal surface, and a portion of the ankle. All of this you'll learn in radiographic procedures in X-ray school. Hold steady, last picture. Good. All right, Natalie. You may sit up now. I'm going to go and process all these images and be sure I have good X-rays before I take you back to the emergency room, okay? I'll be right back. I talked a little bit about the X-ray tube, and I'd like to show you some of the things that we can do with the X-ray tube. Natalie was here on the X-ray table, and so I was able to take the X-ray tube up above her. For my AP image, I had about 15 degrees of angle, which is natural, and that's what we need to correspond with the joint spaces and that incline in your foot. We can do other things with the X-ray tube because it's not always 15 degrees of angle up. We can get more angle up or down, or we could move things around this way. And where that's important is if the patient were to come in on a gurney or on a stretcher and we wouldn't be able to move them onto the X-ray table, we can bring the X-ray tube right over top of them and we can X-ray them lying on the gurney. We often use this for chest X-rays. It lends itself to a chest X-ray, both the PA, posterior anterior, as well as lateral projection from the right to the left. That would be a left lateral. So we take our X-ray tube and turn it so that it's horizontal to the floor. And I'll turn some lights out here. And there is the image size, the image receptor right in there, which would lend itself to a chest X-ray. And of course, I'd want to use my marker. Since it's PA, posterior to anterior, the patient's left side of their body is over here. Okay, Natalie, I got good X-ray pictures of your foot, and I've already sent them to the emergency room on the computer system. We call it Picture Archive Communication System. And so doctor is already looking at your X-rays. By the time we get back to the emergency room, they'll have a diagnosis for you. Okay? Ready to go back? Come on, sit up. Bring your legs over the edge here. I'm going to lower the table a little bit, okay? Make it a little easier on you. Okay. Think you can get back in the chair? There we go.